Sure. Good afternoon. Thank you for joining us today. I'm Jennifer Bender. I'm with Prairie Lakes Healthcare System, and I'm also the Public Health Information Officer with the Watertown Area COVID Task Force. So before we get started today, I just have a brief message to talk about testing. So as you all probably know, COVID cases in our community and region are increasing. And with that increase, that means there's an increased number of tests happening. And so as testing volumes have increased in our region these recent weeks, we've also seen an increase in the positivity rate. So right now at Prairie Lakes, with our laboratory specifically, we've seen a 20% positivity rate. And that rate is pretty significant. So if you need a test, it is up to your provider to determine the type of test you need. There are a variety of different type of tests, like you may have heard of a rapid test or your test being sent to the Department of Health. And it is up to your provider to determine what kind of test you need, and that is determined on your health and also on the supply of testing. So please be patient with this process. Because testing numbers are up, that means you might have to wait for your results. And while you're waiting for your results, whether that's an hour, 24 hours, several days, please follow quarantine guidelines and wear your mask. You need to isolate yourself while you're waiting for your results so you don't pass COVID on to others if you're positive. It is important to quarantine and wear a mask because we need to protect each other. Right now, 14 people are hospitalized at Prairie Lakes Healthcare System because of COVID. This is up from the 0 to 4 people we would see hospitalized due to COVID throughout the summer. COVID symptoms are similar to other conditions like allergies and illnesses like the flu, so it's important to follow guidelines provided by our local infection control nurse with Prairie Lakes, Shannon Britt, who will be on here in a little bit. But first, let's hear a community update from Mayor Sarah Caron.
Good afternoon. Today is Thursday, September 24th, 2020. We're having a bit of a surge, as Jennifer mentioned. In South Dakota, currently 194 people are hospitalized, and we've had 210 deaths. In Codington County, we've had 780 cases, and 200 cases are active in our county right now. There are 373 active cases of COVID in our 9-county region. So hospitalizations are up. The healthcare workers are experiencing the same kind of spread of the illness as the teachers are and employees of our various businesses. It's not shutting us down. It's a bit of a stress, but patients are still receiving excellent care. COVID is spreading, and COVID can be contagious before you have symptoms. So you can do your part to help keep our community healthy and to keep our doors open. You have to stay vigilant. You have to wash hands frequently. Please don't go out if you're feeling sick, even if you think it might not be COVID. It might be COVID. Stay home if you're sick. It is your choice to wear a mask, and that's a wonderful freedom to have, but it's also your responsibility to choose whether you wear a mask or not. It isn't hard to do. I would urge you to please wear a mask if you can, and I will too. And now I'd like to welcome Cindy Brugman, our Codington County Auditor, to talk about voting.
Good afternoon. I'm here today just to give a few recommendations to you to make your time voting a shorter time, limit your exposure to others, that type of thing. The first thing that you need to do is be prepared. Is your voter registration current? Have you moved or has your name changed? If you get those things updated before you go to vote, it's going to make your time at the polling place shorter and reduce your exposure to others. Have you studied the ballot, the candidates and measures? It's not a long ballot, but if you study it and you know how to vote, you're going to get in and out of the polling place much quicker. There are several ways you can vote in this election. You can vote by mail, which over 3,000 people have had ballots mailed out to them. You can vote early at the courthouse. Masks are appreciated. And if you know what's on your ballot and you know how you want to vote, you're going to be in and out of there in about 5 minutes. The county does have a security checkpoint, so to limit the length of time it takes you to go through that checkpoint, my recommendation is to just bring your driver's license, because that is what we need to verify that you are who you say you are. If we have mailed a ballot to you, that is because you filled out an application, and you may have filled it out last spring, and when you checked which ballots you wanted, you may have checked all, which means you're asking for all ballots that you're eligible to vote on in the year 2020. That application will expire at the end of 2020, and if you want to vote by mail the next year or the year after, you will have to fill out a new application. So yeah, you can vote by mail. You can vote in person early at the courthouse. You can also vote on election day. All the polling places will be open just as they were for the June primary. Every polling place in the county will be open from 7 a.m. to 7 p.m. If you know what your precinct is, if you know where you're supposed to go when you get to your polling place, it's going to limit the amount of time and the people that you have to speak with or have any kind of contact with. It'll limit that time. You can get in and you can get out. We have limited booths in the courthouse right now for the early person or early in voting, and that's due to the space we have and setting the booths apart far enough to keep everybody safe. Like I said, masks are appreciated. We also have hand sanitizer in the hallway on the floor where the voting booths are that you are welcome to use when you're finished. If you want a sample ballot, you can come to the courthouse and get one. We have those ready for you. We are going to need to know your name so that we can give you the correct ballot for where you live, because there are 4 different ballot faces for this election. The other place you can look at your sample ballot is on the Secretary of State's website, and that is sdsos.gov. You go to that site, you go to the voter information portal, you put in your name and your birth date or your zip code, and it'll allow you to pull up your voter information, where you're registered, the address you're registered at, where your polling place is, the hours of the polls coming up on November 3rd, and it will also let you look at your sample ballot. On this site, you can also track your ballot. If you have requested a ballot by mail, and we have received it into our office and got everything processed, getting it ready to count on election day, it will show you that we have received your ballot. So there's a lot of confusion right now. People who have had a ballot mailed to them, you can mail it back. It's going to cost $1.20 if you send it through the U.S. Post Office. You can use the secure drop box at the south entrance to the courthouse to drop off your ballot. Or if you're more comfortable with it, you can walk your ballot up to the auditor's office, and we will secure it in the ballot boxes that we have for this election. If you have any questions on your ballot or where you're registered or how you get election supplies, please call our office at 882-6297 or 882-6248. We're there. Our lines have been very busy. You may have to leave a message, but we do check the answering machine periodically throughout the day. So that's basically what I want to say is be prepared and it will reduce your exposure to anyone who may be ill. And we would also ask, if you're feeling ill, please do not come to the courthouse. Do not go to your polling place. Thank you.
Hello, my name is Shannon Britt. I'm the Infection Control Coordinator and nurse at Prairie Lakes Healthcare System. So we're going to come up on influenza season, as well as we're well aware that COVID is running much higher in our region. So I want to go over the differences between influenza, and I may go back and forth between calling influenza and flu, as well as COVID. So both of these are contagious respiratory illnesses, but they are caused by different viruses. Because some of the symptoms of COVID and flu are similar, it's going to be hard to tell the difference between the two. And testing might be needed to confirm the difference, confirm a diagnosis. So what are some of the symptoms that are the same between COVID-19 and influenza? Both of them, you can have a fever or feel feverish and have chills. There's a cough, shortness of breath or difficulty breathing, being tired, sore throat, runny or stuffy nose, muscle pain or body aches, headache, and some people may have vomiting and diarrhea, but in influenza that is more common for children than adults. What are some of the differences? Well, they're few. The flu virus can cause mild to severe illness, including common signs and symptoms as I listed above. COVID-19 the one difference from influenza is that there may be a change in your loss of taste and smell. So as you can see, they're very common in symptoms. As for the spread of COVID-19 and influenza, I looked each of them up separately, and I always go to the cdc.gov as well as South Dakota Department of Health for my information, and I looked this up moments before I came in because things do change rapidly. And both of these listed exactly the same for how they're spread. The virus is thought to spread mainly from person to person, and especially in close contact, which again, as you've heard all of us say over times, is that's about 6 feet or 2 arms lengths from each other. It is spread through respiratory droplets when an infected person coughs, sneezes, or talks. And then those droplets land in your eyes, nose, or mouth. So some studies have also stated that COVID, as well as influenza, can be spread for people who might not even have symptoms. Again, that's why we've asked over and over is for the social distancing of 6 feet. It's just to give us that distance that we could spread when we talk, sing, cough, any which way that this virus can spread and then get into our mucous membranes. And especially for the fact is we could be spreading it and not even realize that we have one of these viruses. As for how contagious these are, influenza, for most healthy adults, you can be contagious a day before you have symptoms and up to 5 to 7 days after you're sick. So for people with influenza, you can be most contagious in the first 3 to 4 days after you're ill. But again, you can be giving the disease to others 1 day before you become symptomatic. For COVID-19, we're still learning a lot about the disease, but at this time, we believe that it can be contagious for 2 days before you have any symptoms, and it can last you can be contagious for up to 10 days. And again, for both of them, you can be infected with the virus but have no symptoms. So then you can still spread the virus to each other. Again, as Mayor said, it's 6 foot distancing. We're not making you mask, but it's another step to reduce the opportunity of exposing others. For the complications of influenza, most people with influenza recover after a few days and maybe up to 2 weeks. But some people will have complications such as pneumonia as a result of the flu, and there is the possibility of life-threatening and the resulting in death for some. COVID, we still have a lot to learn. Again, lung issues, pneumonia has been a complication, but they're still studying, but they're finding long-term heart damage, scarring the lungs, and even strokes after having COVID. How do we prevent influenza and COVID? Again, as I looked them up, these are one and the same for each other to how to prevent influenza and COVID. Be sure to take everyday precautions, such as avoiding people who are sick. Please stay home if you're ill. reiterating what Jennifer said, is if you're being tested, please stay home until your results are in. No news doesn't mean that you're free to go until you get something. Is if you were concerned enough that you had influenza or COVID, please stay home and limit possible exposure to others. Remember to cover your cough and sneeze. Best is to go into the crook of your elbow, and then you don't have to get it on your hands and worry about getting your hands washed immediately. Be careful mindful of washing your hands with soap and water or alcohol-based hand sanitizer. Avoid touching your eyes, nose, and mouth. That way, if you've picked it up off anyone or have sneezed, it reduces your risk of getting it into your eyes, nose, and mouth and getting the virus. And clean and wash your surfaces and objects that might have been contaminated with the virus. And additional to COVID, when you're inside your home, again, definitely try to stay 6 feet away from people. And that was one thing CDC really pushed, was for COVID to stay 6 feet away. But again, that applies to influenza. Again, masking is highly encouraged to prevent the spread of COVID-19. When you can end isolation or being homesick with either one of these conditions. With influenza, we say to stay home for 24 hours after the end of your fever when you haven't been taking any medication to reduce your fever, unless you need to go out for necessities or to see your healthcare provider. Again, there's a lot of people still being able to help you if you need necessities to not have you out and about in our community. For COVID-19, you can discontinue being home when you've had 10 days since your first symptoms have started, or that you had your first positive test. 24 hours have passed since the last time you had a fever without the use of medication, and that your symptoms have improved. If you're one of those persons that tested positive for COVID-19 and didn't have any symptoms, you can be out of your isolation after your 10 days from your positive test. Another thing to kind of throw your way, we do have cold season coming. And what is the difference between a cold and the flu? Generally with a cold, it comes on gradually. Influenza is quick. Rarely you get a fever with your cold. Influenza, it lasts 3 to 4 days. You may have aches, but with a cold, that's not common. With influenza, it usually is a symptom, and they're often severe. Chills are not common with a cold, but they're fairly common with influenza. Fatigue and weakness is sometimes with a cold, but it's very common with influenza. Sneezing is very common with the cold. It happens sometimes with influenza. As for stuffy nose, is common with your cold, sometimes with influenza. And the same with a sore throat. And with a headache is not common with a cold, but is very common with influenza. I know it's a lot of information I've presented to you today. All of this is on the CDC website, and they match them up to be able to see the differences and the similarities between colds and influenza, as well as COVID and influenza. If you have any questions as we go into these seasons and you're not feeling well, you can always call 211. They have people trained to advise you and help you go through what you're experiencing. Or you can call your healthcare provider and work with them accordingly if you feel that you have something that you need to be seen for or tested. Thank you.
Thank you, Shannon and Cindy, Mayor Caron. Are there any questions from the media?
Question for you.
Oh, great.
Perhaps we touched on this in the conversation you and I had a couple days ago, but I think you mentioned at the beginning that could you just kind of explain why testing would be delayed if the positivity rate has increased?
Sure. So testing might be delayed really because of supplies. So as cases go up, the more people are being tested. And Prairie Lakes, and I'm sure other facilities as well, are on allocation or kind of like an allowance of how many testing supplies you get from the state. So if, say, I'm just making up numbers, but if the state sends us 400 rapid tests for a week and we run out of those 400 tests, then no one else is going to get a rapid test. So as a facility, you have to prioritize who gets these tests. And as more tests go up, then the supply becomes, less. So it's really a supply and demand thing. So the more tests that happen, the more they have to prioritize who gets certain kind of tests. And that's really up to each provider to decide with the patient.
Okay, and the non-rapid tests, those are sent out to the state lab then?
Sorry, what did you
The non-rapid tests, those tests are conducted at the state lab or something like that?
It really depends on the facility,
Okay.
but at Prairie Lakes, we do send to the state. Yep.
Okay, thank you very much.
You're welcome. Perfect. Any other questions? No? All right. Thank you so much for joining us today. We will likely be back again next week on Thursday at 3 o'clock. Have a great day, and I'm wishing you well.